Good morning. Thank you all for joining us on another episode of the Compass Ecosystem Podcast. My name is Carolyn Gorst. I am the Director of Development and Communications here at Compass Affordable Housing, and I'm really excited to be joined again with my fantastic co-host Lydia Aranda of Rainmakers. Hi, Lydia.
Hi, Carolyn. It's great to be here again for another informative session and a fun one, too.
And a fun one. I'm really excited. So, before we get started, I just want to remind everyone that the purpose of the Compass Ecosystem podcast is to inform, engage, and to connect with the Southern Arizona community in a dialogue about our human development system. So, our ecosystem is built on community partnerships, and we're really excited today to have an exciting community partner joining us. Our segment today is brought by our other partners, Tucson Electric Power. So thank you for Tucson Electric Power for sponsoring this segment. With us today is Eden Health. Hi, Eden Health. I have Emily and Carmen with me today.
Hi, guys. Thanks so much for having us.
Hello, thank you for having us.
Nice to have you here.
We're very excited for you both to be here. Emily, I understand that Eden Health has many offerings outside within the healthcare context.
Yeah.
So let's kick things off. Could you tell our viewers and listeners a little bit more about Eden Health, some of
I'd
the
love
work
to.
that you're doing, your target audience, your services, some of the outcomes that you're seeing in community?
Of course, of course. So my name's Emily Erstad. I'm the executive director of the Hospice and Palliative branch of our continuum of care. We also provide home health and home care. So all four services. Palliative is our newest addition, and I think what inspired Carmen to connect us with you guys and to just talk about how we can support our Southern Arizona community. We're unique in the sense that, yes, we service Tucson, but we also go all the way down to Douglas and Sierra Vista, and we're all the way out to Safford, Morenci, Clifton, and those areas. With that comes a lot of unique challenges, and that's kind of why we have the need for palliative, which, I'll kind of pause and see if that answers some of your questions before continuing, but that's why we're here.
I absolutely think that's great information for our listeners. Can you go a little deeper on telling about some of your target audience, especially with hospice and palliative care that you're working in?
Yeah, totally. I mean, hospice, I think that's something, there's a lot of fear behind that word. And there's a lot of fear with understanding that that time comes. We all die in our lifetime and we only do it once. And with that just comes a lot of barriers, confusion. And so obviously anybody that has a terminal diagnosis that is wanting pain management, comfort care, social services, spiritual services in that time of need, we provide that care to the patients, but we also provide it to their families, which I think is just as important. And so anybody that's finding themselves in a space that they're needing that support, I think there's a huge misunderstanding that palliative or hospice is death right away, and that's not the case. You can come on a lot earlier, even up to a year prior, as long as your provider agrees, and we meet our plan of care. And so I think that we have a lot of health concerns. There's a lot going on in the world. There's a lot of heaviness. And so my mission is really to take the fear out of hospice. And that's hard because death is scary and not anybody understands what that looks like. So with that, it's going to be a big initiative. That's not a culture we're going to change in the next 5 years, probably not even the next 10. I think that's going to be a life goal of mine. And for that, we'd introduce palliative. And that is what brought Carmen into my life. I actually am a speech pathologist by trade, started my career in head and neck cancer back in rural Indiana. And so we're kind of coming full circle. A lot of those patients I treated were palliative appropriate. And so what's the difference between palliative and hospice? I can give a little bit, but I'll also give it to Carmen. Palliative are people that might have a terminal diagnosis, a chronic diagnosis that is declining. They're needing more care. They're needing more social support. There's a lot of misunderstanding of what's going on. They're going to their outpatient provider, and it's just heavy and shocking. And so sometimes these are patients that have cancer or a major diagnosis that's affecting a major body organ. So think of your liver, your heart, your brain, your kidneys. And when that starts to happen, hospice kind of starts to be in the talks, but they're not ready to give up, right? And I want to completely reiterate, we're never giving up when we sign up with hospice. It's just looking at quality versus quantity sometimes. And so there's people that are stuck in that in between, or just searching for, is this going to work? Is this curative? Where am I at? Palliative is a super important, I would argue, social program that we need to be providing, where we're plugging resources into these families earlier so that when they do have that time to come onto hospice, we're not in crisis. We're giving people time back that they don't have. I think crisis is a big part of why people are so fearful. And having that conversation in your doctor's office and then going home, nobody wants to make a decision right then. But palliative also gives opportunity to other people that aren't terminal, that just need a little support to get back on their feet. We might be able to send them to home health. We might be able to provide them with extra social support that didn't exist prior. But we're just looking for ways to partner with the community, especially in these rural areas that don't have as much access.
Love
Correct.
that.
And I do agree with Emily. That is something that we are trying to change within the community, to raise awareness that when we start having these conversations, it's not a bad thing. We want to be your partner. And whichever way that goes, are we having discussions where we're keeping you on palliative and, plugging in the things, the resources, social work, discussions with chaplain, if we have those patients that are, following a certain religious belief. So we try to partner with them and just educate that we are here along the way. And does that look like more where you're heading towards hospice, that we start plugging in more resources and really having those conversations to really tie around the acceptance, and knowing that, just because you're going on hospice, it doesn't mean that you're giving up. It's just we are trying to partner to make sure you're comfortable and that you have all the necessary resources that you're needing during your voyage through hospice, or is it palliative, or like Emily said, we send you back to home health or PT, whatever that kind of looks like.
I love. Oh, go ahead, Lydia.
Sorry, I was just going to say, I think the way you both present this really makes it easier for listeners and viewers and people in community to receive it. And like any new information or any new health situation, there's going to be a lot of information that might be confusing. And it sounds to me like you are sharing it and making yourselves and your teams available so that if people have questions, they can ask. If they don't know that they have questions, they can just know that you're there for when they're ready to have conversation.
Yeah,
Correct.
I think in this, it's interesting. We just building trust. I think the only thing that's going to combat fear is trust, and that takes time, and that takes authenticity, and it takes just showing up. And I think sometimes that's the hardest thing to do, especially just in the climate of just how crazy the world is in general. And so sometimes this can feel like one more thing. And I think our goal is to kind of remove that barrier and say, we're just here and we're showing up. And I always kind of explain it like, you don't want to look at your bank account at the end of the month because the bills are coming out, and it just makes you want to, but it still happens whether you're looking at this or not. We're not changing your prognosis. We're not changing the timeline. We're not changing anything other than just showing up when you need us.
How reassuring.
That's just beautiful. So we're going to take a quick break to hear from our major sponsor, Tucson Electric Power.
It's important that Tucson Electric Power partner with agencies like Compass Affordable Housing to ensure the members of our community have access to the resources that they need. We understand that we're operating in an affordability crisis, and this is not something that can be solved alone. Together, we can achieve so much more.
We're back, and this segment is brought to us by the support of Pima County Short-Term Crisis Emergency Resources Grant. Carmen and Emily, thank you so much for all that information that you just shared. And again, I really resonated with what you brought up, as with all of the services, all of the options and opportunities to work together, what you're really working on as an underlying is building trust. And that does take time, as you mentioned, Emily. I wonder how you might describe how your agency goes about the work of building trust in community.
Sure. I think that really starts with leadership. I really hold myself to a high standard. I think starting as a clinician and just my walk through my career, it starts with me. And I had to hire a team that resonated with me and understood my vision, and then empowering them to create their own vision for them to go out. It's just people putting people first. And I think putting people first, but holding them accountable. And that accountability translates to our patient care. And I think that's kind of where you can read leadership books, you can hop on podcasts, you can whatever. But I think just showing up and being these people that you can just have a conversation with, and really wearing my heart on my sleeve. I've been a heart first leader for a really long time. And that has brought me a team that also leads heart first and is really compassionate. And that's just me being honest. I don't think we don't have it perfect. I don't have it right. We mess up. We're not. And I think that's like we kind of rolled out palliative to our health and wellness partners this week. And I told them that. I said, we're going to do our best, but we're not going to do it the right way, because there is no right way. There's no playbook for this. There's a reason people haven't done palliative. And I'm sure I'm about to find out. I don't think I have secret sauce. I just think I am a little stubborn and perseverant and a little overcaffeinated, to be honest. And that's probably the only difference. But I'll let Carmen kind of speak too, because I think when I hired Carmen and we started this journey together in January, because I've been with the company for a bit, she could probably has her own perspective on what that looks like.
Thank you. Yeah,
Yeah.
Carmen, and the overcaffeinated, I'm just going to say quickly before Carmen starts that while that's tongue in cheek, the fact is that palliative care is 24/7.
Yeah.
Hospice is 24/7. The kind of issues that people have in crisis comes at any hour of any day. So that's a particular approach. Carmen, what do you think about?
And that I agree with Emily, and exactly how Emily says she leads with heart. I think that every single one of us that are part of this team do lead with heart, compassion. We share, learnings, how we can make things better, and we really explore like. And again, we don't have it perfected. We are going to learn a lot of things along the way, and then one thing is that I'm originally not from Tucson, but I was with an organization in the past where we did start a palliative program from pilot and then made it successful to where they have now actually rolled it out in other areas. And I was just glad to be able to grow and learn from that. And that was kind of something that I'm bringing to the table with Eden, and just trying to roll it out and raising awareness and doing the educational piece and holding their hand along the process. That's basically, it is scary, like Emily had mentioned. And I feel that I've gone through it with personal experiences, and I know what I've experienced and endured during that process. And how do I put that and plug that in to make it easier for someone else who is brand new, just like myself, going through something and not knowing which end is up, where do you start? And the palliative program is a great way to start, because you have all these resources and you get the help, and there's so many pieces, and just ask, and it's like you will receive. And if we don't know, we will ask and we'll figure it out. Maybe there's something else that we need to plug in, but we're going to learn along the way too, because not everybody has the same need.
And I would like to kind of couple out, like just what you said, Carmen. We each bring our own walk, but there's many others of us that have had walks with loved ones, their own walks, watching their friends go through it. It's through experience and it's through collective experience, I think, that makes us different. I will Eden Health is 100% employee owned, and you will really see that they allow us to be people first. They allow us to look and meet people where they're at. There's not a lot of companies that would go out on a limb and start a palliative program while everybody else is not. And it's bold. And I think that makes me really value Eden as my employer.
I just love that. And I want you to take I'd like the two of you to just go a little further on what you were just talking about, because you really laid the groundwork for my next question that I think our viewers want to learn more about, is talking about how Eden Healthcare, and specifically the hospice and the new palliative care, plays a part in the human development ecosystem here in Southern Arizona. how you participate directly with people, building on the idea of people serving people.
Yeah. I started with the company about a year and a half ago, and we weren't in Tucson predominantly. Our home health was, but we weren't. And so I had a very unique opportunity to build this team from scratch, which comes with its challenges because you're kind of shooting in the dark. You're like, I'm going to try. I'm going to see if I can find people. But with that, gave me an opportunity to see if we could start over, what would we do different? And so because I did come from a different hospice that I acquired that hospice. It wasn't a fresh team. It wasn't a fresh face. There wasn't things to be undone. And that was where my energy was going. And so with that, volunteer programs, I really want to push that here. Why can't we make this a community effort? There are so many people that have loved ones that have gone through experiences that would love to give back, and I wouldn't recommend, to put my little 2 cents in here, if it's a recent death, give yourself 6 months. We require it for you to process your grief because grief is mysterious and it catches you when you're least expecting, and it always somehow brings you back to a fearful place. And I think someone should do a case study on that and report back, but maybe it'll be me. Being able to volunteer and make this just as much about the community as it is us. And I know there's other hospices that do this, but I think putting our community first and really getting to do that Tucson has a lot of hospices. We have a ton. I mean, why, Emily, why'd you start another one? Nobody's doing it like this. Nobody's doing it with a 100% employee-owned company that would put their financial interests aside to start a palliative and then build a foundation for volunteers to give back. And I think in a time that we feel out of control, this is a great way to impact our communities with just such small acts of service. Why not expand that pool and find more people that can share their experience with us so that we can just be better, do better, and bring that connected care home?
Makes sense.
Carmen, anything you would want to add to that before we go into break?
Yeah. So another thing that we bring to the community is that we try to engage in health fairs, anything that's out in the community, or even going out to skilled nursing facilities, wherever they ask us to have presence. When we're out there talking to anyone in the community, we are just going over everything, answering any questions. And I feel that doing that educational piece is crucial. Especially when there's so much fear about when we mention the H word and the S word, because everybody does not like to hear the complete word. So we call them, what it is. But just doing that educational piece, like saying, this is what it looks like. These are the things that we're working on, and just really being that partner and being available. I think that is crucial in our community, where we just need to raise awareness and do that educational piece and be available if they have questions of any kind and what that looks like.
There is just so much in that, but at the same time, it comes down to simple approach and keeping it simple so that folks can reach you when they need to and can understand and learn and grow through their own journey with you along as guides and experts, but also as the strength that they may need, a shoulder or just a light to shine the way and help them as they make difficult choices.
Right. And let them know it's okay that at some point in our life, we all go through it, unfortunately, but at least you have, and that you have a resource, someone that you can turn to.
It's so true. So we're going to take a quick break here and hear from our sponsors at the Tucson Osteopathic Medical Foundation.
Annually, we give to local organizations who are running programs and making great strides in what we call the social determinants of health. It's incredible the work that they're doing, and we're just really proud to be a part of it.
And we're back to continue our conversation with Emily and Carmen. And we want to again thank our major sponsor, Tucson Electric Power, for making this show possible. Eden and Carmen, in this last segment, you spoke about so much information and ways that the programs and services you offer touch so many different people along their various phases in palliative and hospice. And maybe even before that, folks may have questions and that you're available to answer those. And maybe talk to people even ahead of time so that when the time comes, perhaps the crisis won't be as scary. With that, I wonder if you might share with our viewers how they may find you, be in touch with you, ask questions, and also if they might find you out in community anytime coming up.
Yeah, I'll give basic contact info and I'll let Carmen talk about community because that's her expertise. You can always give our office a call at 520-335-6118 and you'll get a whole menu for home health, home care, hospice. I think we're number one, but don't quote me on that. You'll know when you listen to the
The
menu.
menu will tell us. Right?
Yeah, I should know. I've called it enough. We do have, 8 to 5 for typical business hours. We also have an office on Broadway. It's 6245 East Broadway, Suite 150, that big Nova building on Wilmot and Broadway. We're the first floor, so you can visit us anytime. And then I'll let Carmen kind of speak to how you can find us in the community.
Thank you.
Yes. Yes. So we have some upcoming events. Of course, I have some events where I'll be doing Casitas on Broadway, which is May 19th. We're doing a craft rag doll type of event for the seniors, and anyone's welcome to join us. That is on the 19th from 10 to 1. We also have, of course, and then I'm out in the Safford community pretty much all day, just kind of reaching out to providers. And so for just doing my networking, checking in, seeing if there's any educational, any things that some of these provider offices might need. I also will be attending a spotlight event. I do transitional living centers, partnering sometimes with the communities out in Casa Grande, even though we are primarily not out there, but we are building relationships just to bring that educational piece within all the communities here in Arizona. We also are doing a Benson Veteran Community Connect coming up on May 22nd, where we will be there from 7 to 5. So we try to stay pretty active within the community in quite a few events that are coming up within our senior living centers, working with memory cares, Alzheimer's organizations, and we really try to plug ourselves in to just do the education or the just out there in the community, raising awareness of who we are.
And I will say for any volunteers that are interested, you can give us an email and it would be, you can email Carmen, you can email myself. It's our first dot last name at eden-health.com. We're always interested in volunteers, or just call the number and we'll redirect you to that application. You can always look us up online too, and there's ways to get to those applications there as well.
I think that's so important. Gosh, so many different ways and different approaches that you are taking to be a part of this continuum of health and well-being and community, and part of an ecosystem like Compass is so incredibly dedicated and committed to not only participating in, leading, serving in, but encouraging others to be a part of, that are so vital. As you said, the cycle of life. We are all a part of it. And so Eden Health is there to answer questions, to help serve, and to join hands in community all over, beyond Pima County. It sounds like Greenlee County, Cochise County, lots of different places, and Graham. So thank you so much. I got Carolyn. What a robust list of services, programs, and the enthusiasm from both of you. I just can't thank you enough for what you do.
Thank you for having us. I appreciate it.
We love it. Thank you.
So I'd like for Emily or Carmen, I'd like for either one of you one more time to give your website and a phone number for everyone tuning in today so they can reach out to you to learn more about utilizing your services or getting involved with you, whether it's as a volunteer or having that conversation with loved ones before before it's needed.
Yeah, definitely.
Go ahead.
Yes, you could reach out to me if you like. We have the general phone number where they can call and they can connect us directly at 520-335-6118.
I'd love to have your give us the website people can find you.
Yes, and that would be at edenhealth.com.
So www.edenhealth.com.
Correct.
Perfect. Well, Emily and Carmen, I can't thank you enough for joining us today and shining the light on the work that Eden Health is doing and helping to demystify a little bit about the scariness that goes around hospice and palliative care. But as we all know, it is a part of life. It's a part of the life cycle. For our viewers, you can always learn more about the work that Compass is doing and our partners by going to www.compassaffordablehousing.org. And to my great co-host, Lydia, to my guest, thank you. I appreciate all of you tuning in, and we look forward to seeing you again next week.
Thank you,
Thanks.
everyone. Have a
Thank
good week.
you. Thank you so much.